location because we've got, as a result of the latest storms, we have a tree being removed from the driveway. So can you see me and hear me okay? Does everything look all right? The light okay, Rochelle?
Yeah, everything looks good. So sounds good.
So thanks to everybody for joining us today. And I want to start off just talking a little bit about where we are. And I think what has to be done now, and make sure that you hear from me, and then answer any questions that you might have. So this week has obviously seen a lot of activity, particularly with conversations about restarting our economy. At the beginning of the week, we announced that, or perhaps it was last week, we announced the beginnings of a economic restart task force for the Big Four, and came together, and that group and the subgroups have been meeting regularly all week, performing a Herculean task of trying to, in a very condensed time, take this tall order of restarting our economy and putting it into a document that we can all agree to. We had hoped to have that document to you by this time, 1 o'clock today, but unfortunately a little bit more work has to be done. The meeting this morning, which I attended, was vigorous in its conversation, and so we have to make a couple more changes, get everybody's sign off before we share that with you, and we'll be doing that as soon as possible. We also know that Governor Lee issued his proclamation this week that he would let his safer at home order expire next week, and that in fact on Monday and Wednesday he would begin opening businesses in our community. I know that I have said that we're going to be cautious and looking at data, and I certainly am distraught that members of our community are hearing mixed messages for what is going on. We want people to have clear guidance about how we can move forward. Unfortunately, that's not always possible. And so, but it's important to note that Governor Lee carved out exceptions for the 6 counties that he did, because he knows that places like Chattanooga look different than every place else. And so we're trying to make sure that we come up with the best rules. So my plan is to put out this Big Four task force report. It's 98% finished, and so we know what's going to be in there. I can talk a little bit about that. And then early next week, also be talking about what that means for Chattanooga. Take that Big Four document, translate it into concrete actions for our community, talk about timing and phases. That document that we have for the Big Four roughly outlines what we're going to be doing, and that is 4 phases of gradual opening, making sure that we're looking at data along the way and only opening up if the numbers call for it. There are public health experts on that task force. I've been talking to them regularly. I've had calls this week with Vanderbilt, with the Hamilton County Health Department. We have members on the task force from the University of Tennessee, trying to make sure that we're making really good decisions for people in our community. I just want to emphasize a couple of things. People still need to be safe. No matter what Governor Lee does, no matter what I do, everybody still needs to take precautions, to wear masks when they go out, to make sure that they are physically distancing themselves from other people. That message has to continue to come through. The second piece that I'm going to say now, and I'm going to continue to say, is the safety of our community and the restarting of our economy go hand in hand. Those two things are linked. And people are only going to go to restaurants and to retail establishments if they know that they are safe and they feel comfortable doing so. So we have to create an environment where people feel safe, where they know they're safe, where the numbers show they're safe. And that's what I'm going to be focused on as we seek to restart the Chattanooga economy. And with that, I'm happy to open it up for any questions.
All right, up first, we've got Shannon Sharp from News Channel 9.
Mayor, thanks for doing this. Can you kind of talk about what the conversation has been like between you and Mayor Coppinger when it comes to you deciding to hold off and him deciding to move forward?
Yeah, so I talked to Mayor Coppinger on what morning was it? It's really hard to tell. Whatever morning it was that
announced on Tuesday.
Tuesday, okay. I talked to Mayor Coppinger on Tuesday morning. We spoke about it, and what I understand, as well as anybody, is that he has to make the best decision that he can for his constituents. We chatted about it. I told him what I was planning to do and offered to give him any more information. We talked about it for a while, and then I think he did what he felt was right for the county. And I just told him that it was absolutely not antagonistic, as it just isn't between us. We just had a conversation about it. He told me what he was planning and why. I told him what I was planning and why, and that was really the end of the story.
All right.
So there was, can I follow up real quick, Rochelle?
Yeah, go for it.
So there was no discussion about trying to come together to come up with a plan so that it would be a little bit more easy to understand for residents who travel in and out of the city or live in the county and work in the city, that kind of thing. Was there, I know you said you told him your plan, he told you his. Was there a talk of collaborating with each other?
Yeah, when we talked about it that morning, I think the discussion was a lot, the conversation that I think that that we were having was about, what the plans were going forward. I think Mayor Coppinger obviously felt strongly that that he should follow the governor's plan, which I respect and understand. I don't have a lot of input into what the governor's plan is. We were working with them, of course, and talking to them, but I wanted to make sure that we could do something that was right for our city. I did not think that we should open up bars and restaurants on Monday. And so there, at that point, there really wasn't a lot else to talk about.
Up next, Callie Starnes, Channel 3.
Callie, you're on mute.
There we go. Callie, you should be good.
Thank you. I appreciate that, Rochelle. Two quick questions kind of related to that. The first being, I know, Mayor Berke, you spoke a lot about data being very important to you, and you touched a little bit on where that data is coming from. Is there a difference in where the county and the state are getting their data to make their decisions versus where you are finding that data? That's the first part of my question. And the second is just, despite kind of how we got here, we're here now. So what's the plan for communicating with citizens who might be confused? If there's, a parking lot that separates a business that can open and a business that can't, what's the plan for you and your staff to communicate with folks at this point?
Yeah, well, I think really as far as the state goes, I think you kind of have to ask them what they're looking at, because if you look at the overall state numbers, they're climbing. And we saw that. I know that there were some questions asked about that this morning. And so, most of what we've been seeing is that public health experts want to see consistent decline before you alter your regime and get more people together. And so a lot of what I'm looking at is making sure that our numbers remain low, and that as we expand testing, because for a long time testing was extremely limited in our community, as that expands and we get a better picture of what's going on in Chattanooga, we can still see that we can handle the caseload, and that we never get to the point of that logarithmic expansion like you've seen in some communities. As far as what happens in the future as to communicate this, I'm going to continue to communicate as directly with people as possible through communication like social media, Facebook Live, by inviting people in to hear more about our plans. As you know, I do many calls every day with different groups like child care providers or faith leaders or business officials. I'm going to continue to do those. And the most important thing that I want our residents to hear is that they have to continue to be careful. When the stay-at-home order expires from the state, then for much of our community or much of our state, they're going to think that there aren't restrictions. And we know that individuals over the age of 65 are, by our own Hamilton County Health Department, are recommended to shelter in place for the foreseeable future. I believe that we still should only be going out to perform important tasks right now because physical distancing has worked in our community. We've done what we're supposed to do. That is the good news. And we have to make sure that as we open back up and as we restart, that we're doing it at the right pace so that we can protect people, keep them safe, and actually gain the consumer confidence that we need for them to go to restaurants and retail establishments and more.
All right. Up next, we've got Kim from the AP.
Mayor, I was just hoping maybe you could talk a little bit. You described the possible confusion as, you're distraught over it. Do you have any specific examples of what you're currently, what current confusion is happening right now? If you could just expand on that, that'd be great.
Yeah, the place where it's not always about the confusion, it's about the discrepancy. So you have a restaurant in Chattanooga saying, I understand why I'm closed, but the place that's down the street is going to be open and I'm going to lose customers to them. The same with all kinds of other establishments. And so what Chattanooga restaurant owners and retail establishment people are asking me about is, what are we supposed to do about the fact that the rule is different down the street, a mile away, wherever it is? And many of them are saying that they are worried and don't want to open. We're hearing that a lot. I want to be clear, we don't hear that from everybody, but a lot of owners are saying we want more clarity on how we can be safe before we open, and what's going to happen if these places down the street are opening and we're not. And I think the final piece that I'm hearing much more from residents, some of whom are extremely worried about this, is what's going to happen if it actually turns out to expand the number of COVID-19 cases and we all live in the same community. And that's the truth is that we're all inextricably bound to each other, and that crosses city and county lines. It crosses state lines here in Chattanooga, and certainly everywhere in our country. We know that what happens in one place affects the other, and so as Georgia has even more openings going on than Tennessee, and Tennessee has more openings than the city of Chattanooga. It creates a lot of confusion for people and a lot of concern as well.
Gotcha. Thank you.
Up next, we've got Emily from Channel 3.
Hey, Mayor Berke. I guess my question really pertains to the task force. I know you're on the force with Mayor Cooper from Nashville, and you mentioned that the plan that you're about to release isn't finalized yet, but I was wondering if you could give us an idea if that plan kind of coincides with Mayor Cooper's plan. Are we going to be releasing the economy in 4 phases? What does that look like?
Yes. And before I do that, I will say just one little bit of Zoom humor is that it's pretty funny that I need to look at the little box where your names are, since I can see none of your faces, but I'm actually changing my eyesight between boxes, even though I can't see any of y'all. So thanks, Emily. Yes, our Big 4 plan is going to look substantially like the plan that you saw from Nashville. We've been talking together. All of us have been trying to come to a common understanding. That doesn't mean it's going to be exactly the same, because I think everybody is starting with an understanding, with a basic idea, and then adapting it to their own community. But we're all working from the same premise, and you saw much of that in the plan that Mayor Cooper came out with yesterday. And then, as I said, at the beginning of next week, as we adapt the plan specifically for Chattanooga, it's going to look remarkably similar.
Okay, and then just real quick on a follow-up, if you were an organizer for an event, planning something for late summer with a large gathering, let's say River Band, for example, do you think that that's safe for people to go ahead and start planning for, or do you see that being pushed back to fall?
Well, I think first of all, and to give the specific example of Riverbend, I think that they are looking at fall. Last that I spoke with them, but I think that listen, I was on the call with public health experts this morning. Many of them were skeptical about when we're going to be able to have large gatherings above 50 people. Some of them were much more lenient about that. And I think that really the next weeks and months will tell on that, because we need to start opening things back up, looking at data, seeing what the transmission rates look like, understanding how quickly and how often our numbers are expanding here, and then look more at large gatherings. Our plan, like most every plan, will have those large gatherings as the final piece of the openings.
Thank you.
All right. Looking in the chats, making sure I didn't miss anybody.
I don't think anybody really enjoyed that Zoomer humor there, Carrie. I don't see a lot of additions to the chat. Say, oh, here you got one laugh. So you feel it's a cold room. It's a cold room.
Okay. If anyone else has an additional question, we've got a little bit of time left. If not, we can let Mayor Berke wrap some things up. But I'll give it just a second for. Okay, now everybody's pity laughing at Carrie. That's great.
Yes. Okay. That's what I was doing. I'm working hard to get my chief of staff a pity laugh. This is what I've been reduced to.
This is great. I'm so glad we're recording this.
Okay, listen, y'all be safe.
All right. Yeah, thanks, guys.